G'day, Brendan here. MGTOW Level 3. This video today is entitled MGTOWs and STDs, and is in direct relation to Sandman's video about STDs that was posted only a few days ago. I read with interest the comments relating to this video, and I wanted to comment, but I have a lot to say on the topic and I didn't want to type for ages. So I thought I'd post a video instead, and you'll get to see my smiling dial with a 3-day growth and a few wines in me, and oh yeah. Anyhow, STDs. Like I said in one of my other videos, I've slept with between somewhere in 50 and 200 women. I stopped counting when I got to 50. It's been a lot. And I was married, but I never cheated on my ex-wife. I never cheated on any girl, actually. Anyhow, the main way to avoid STDs is twofold. You can use a condom, which is a slightly more unsavory way, because condoms don't really... How can they put a man on the moon 40 years ago but they can't make a condom you can feel through? That's my question without notice. Condoms suck. And not only that, if you really rely on the fucking things, they break. If you've got a decent sized cock, it's not hard to break a condom. The other way you can avoid STDs, there's 3 ways really. Condoms, which are pretty good for knocking back most of them, as long as you don't break it. Abstinence, fuck that. But every second poofter and their mate on fucking YouTube is like, well, good thing I never get laid anymore. Yeah, that's really good. And the third way is fuck good girls. Get quiet girls. Get girls who don't get the shit fucked out of them all the time. Get girls that are quiet. Get girls that are intelligent. Get girls that are, in inverted commas, good girls. Aside from anything else, it's normally good girls that you convert into raving fucking nymphos. If you're doing your shit right, which I do. And that actually relates back to another video I was watching of Sandman's recently about Omega and Alpha males and Zeta males. But I'll go back to the STD thing. Sandman incorrectly states in his video that many STDs, you don't know if you've got it. As a man, with most STDs, you fucking know if you've got it. If you have HPV, that's genital warts. You notice genital warts on your dick. If you have chlamydia and it's untreated, after a few weeks it stings to piss. And it only gets worse until you get antibiotics. And you will get it treated, because you will hate pissing razor blades, and you will want to fix that problem ASAP. Herpes. You will notice a big fucking rash on either side of your dick, and you will notice the painful blisters. I've never had herpes, I don't have herpes, but I've fucked girls who have herpes, and they told me, luckily. But herpes is only sexually transmittable when there's an outbreak. If a girl's got herpes and she hasn't got an outbreak, about a week either side of it, you can fuck the guts out of her and you're not going to catch herpes. She fucking knows if she has herpes, because she gets a painful blister-like rash on her pussy. The thing is, herpes is also on your lips, a cold sore, herpes simplex, which can be sexually transmitted to a female if you go down on her while you have a cold sore, which is a pretty shitty thing to do. But if you've got cold sores, you know about it. You don't kiss a girl when you've got a cold sore. If you don't have a cold sore, a weak at either side of it, you can kiss a girl and you won't give her cold sores. Now, don't quote me on this, but something like 80% plus of a population have herpes simplex, which is cold sores. They get on the lips, usually due to stress, usually due to sunburn, change in the climate, anything that causes stress on your body. Can cause an outbreak of cold sore, which is actually technically herpes. Herpes comes upstairs. Herpes comes, where can I do it? Downstairs. Downstairs. Where? Downstairs. Around your dick. So, most people have got fucking herpes. There's a good chance you've got herpes. I know I get cold sores occasionally. Thank fuck I don't get them very often anymore. And when I got herpes, I don't kiss anyone. No, not when I got herpes, I don't kiss anyone. When you got herpes, it's like luggage, you got it for life. When you got a cold sore on your lip, you don't kiss someone, because you don't want to give it to them. Most people have already got it. It doesn't really matter if you fucking kiss someone when you get a cold sore, because good fucking chance. Some people are what's called asymptomatic, which means they have the virus, but they don't show any symptoms. They don't get blisters downstairs, they don't get cold sores in the lips. They got herpes, they're a carrier. This is the fucking bulk of the majority of the population. And then you got crabs. Crabs is just fucking head lice for your dick. I remember the first time I ate crabs. I've only had it like once or twice, I think. And I went to a female doctor, and I was like, lifted up the leg of my pants and go, what the fuck is that? She's like, you got crabs, nigger. She didn't say nigger, but she was thinking it. And she said, you got crabs. And she told me to get some fucking shampoo shit from the chemist. I got that shit, and it was all good. Now, chlamydia. Let's talk about chlamydia. Aside from pissing razor blades if you leave it, you don't need to fuck a girl to get it. Chlamydia is a non-specific urinary tract infection. I once had a situation in my early 20s where I was working 7 days a week in a bar. And I hadn't had sex for a few months. And all of a sudden, when I go to urinate, it starts to sting. And there's a slight discharge. And I think, what the fuck? I go to the doctor. He gives me a swab test where they get a fucking piece of wire with a little bit of cotton bud on the end, put it down the eye of your cock, take a swab, send it off for testing. Very pleasant. Very fucking pleasant. Trust me. Put something up the eye of your dick and see how it feels. Not good. Anyhow, he comes back and goes, Brennan, you've got chlamydia, a non-specific urinary tract infection. I said, how? I haven't had sex for months. He said, it's just an infection, nigga. You can just get an infection like you get an infection in your arm or your eye, or sometimes you get a sty in your eye, or you get an ear infection. No one fucked your ear, but you still got an ear infection. So, don't stress about chlamydia. You get some antibiotics, the shit's good. But if you've got a discharge from your dick, and you better hope it's clear, because it might be gonorrhea, which would be really fucking unfortunate, but there's not much gonorrhea going around these days, so you're probably pretty clear. Even that's treatable. There's only two things you have to fucking worry about. That's AIDS, but even that's treatable. Pufters are living now fucking 10, 20 years. They're fine. Niggas are stolen. So, you don't want to get AIDS. You don't really want to get herpes downstairs either. The good thing is, if you get cold sores, it's highly unlikely that you're going to get herpes downstairs, because you already have the virus. And if I had the fucking choice of having blisterous lesions around my dick compared to a fucking cold sore on my lip occasionally, I'll take the cold sore on my lip every day of the week. Because I knew a girl, two girls actually, in the past that I've known, and I fucked both of them. They didn't have an outbreak at the time, but they told me they had herpes. And I fucking saw what it was like, man. It's not pretty. It's painful. They had to take long, hot baths, try and relieve the symptoms. It looked a fucking sight worse than cold sores on your lip, I'll tell you that for nothing. Cold sores on your lip, that's no great drama. It's a badge of honour. It means you kissed a lot of girls, and you're a bit of a whore. That's fine. You know, these people who say, you can catch STDs. I'm only going to fuck virgins. Or I'm going to get married. Or I'm not going to fuck anyone. You can catch a fucking flu on the bus on the way to work in the morning. Doesn't mean you don't catch a fucking bus. You can die on the operating table because of general anaesthetic. Doesn't stop girls getting boob jobs. Doesn't stop guys getting peck implants. There's risks all over the place. Life's a game. You can either pick up the football and play the game and get tackled occasionally and get a little bit hurt, pick yourself back up, jog back onto the field again. That's me jogging. Here we go, both hands. Jog back onto the field again and enjoy the game of football. My response to people who aren't going to have sex because they're worried about STDs is fucking weak. But you're probably a pretty unrootable, sad cunt in the first place, so it's no great fucking loss, and all the more pussy for people like me who still like to shag. So, like I said, this is my response to Sandman's video about STDs. They're out there. Fuck good girls. Use condoms. Go to escorts. They're actually normally, in Australia, they're legally required to get a health test once a month. They're cleaned in the fucking hall you'll meet at 3 AM on a cab rank. Trust me. So, there's my tips. There's my wrap up of STDs. Most of them are treatable. And it's a big of a deal. Chill your ass out, niggas. It's all good. It's part of playing football. Peace out, MGTOWS.